Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Najat Fadlalla. She's a developmental behavioral pediatric fellow. Today's Kevin MD article is How Cultural Competence Transforms Modern Parent Coaching. Najat, welcome back to the show.
Thank you. Thank you for having me again.
All right. And we talked offline the last time you were here over 3 years ago. So thank you so much for joining us again. Now, for those who didn't get a chance to read this particular article, just tell us why you decided to write it and what's it about.
Yeah, so in my training, I got exposed a lot to parent coaching. I did some programs on my own, some readings on my own related to parent coaching. And I was so fascinated by the field and the evidence in it. The one question that kept popping up is, what is missing? And this question kind of morphed into who is missing. And I then realized that a lot of the evidence base for this field was based on a specific population of people, and other groups have been marginalized, as is the case with a lot of the research in medicine. And this kind of prompted me to think of, well, how can we really improve this field? Because it is a beautiful field and it is something that's very essential and it's gathering a lot of evidence. So how can we improve it in the sense of not dismantling what's there, but sort of expanding the walls of what's there and letting more light in? And this is how this piece came together.
All right. So before talking about that, give us a little bit of context. So what exactly is parent coaching and tell us a little bit more about that.
Yeah, so parent behavior training is, in a nutshell, coaching parents through how to work with their children on disruptive behaviors, setting routines, building positive relations, having healthy consequences for behaviors, and all of that. It is the first line evidence-based treatment for ADHD or children who are at risk of developing ADHD. It has been shown time and time again to have long-lasting effects, even sometimes better than medications. So this prompted me to really go dive deeper into the field because of its kind of easy application, even though behavior change is never easy, but it's easier, it's more empowering, it gives parents and children more agency. And this is kind of why I'm interested in the field, and this is what the field is in a nutshell.
All right. And when parent coaching is quote unquote prescribed, for those who aren't familiar with what exactly that entails, just walk us through a scenario, a common scenario of what that may look like.
Yeah. So if it's prescribed and if it's formal, often what parents end up enrolling in is group coaching. So these programs that are 12 to 18 weeks of evidence-based modules on parent behavior training. Another way to do it very informally, which is probably the more common way of delivering parent coaching, is when pediatricians and other healthcare providers are providing like literal like parenting pearls in clinic. They're addressing and responding to disruptive behaviors, but sometimes these big programs are inaccessible or have long waiting lists, and or sometimes the pediatricians may feel like this can be solved with a couple of tips here and there. And this is how parent coaching is delivered. So the formal way, the evidence-based way, is these long group programs, and then the informal way is dispersed in every encounter between a physician and their family.
All right. And your article talks about that intersection between parent coaching and cultural competence. Now, for those of you who get a chance to read your article, just tell us a little bit more about what it's about.
Yeah. So one thing, so the okay, so the main idea of this article is really to tackle what is normal parenting and what parenting behaviors should we be encouraging, and how to adjust our own lens so that we're not pathologizing different family structures that have been working for decades, that are normal and have different set of values in different cultures, but we are sometimes inadvertently pathologizing it because of the way our recommendations are built and because of the way our evidence is built. So the core idea of this article is really to let's really look at our own glasses when we look at parenting behaviors. Let's make sure that we're not pathologizing normal parenting just because it's different or it's based on different values. And then the next step would be how to really deliver culturally competent care in this field.
I can only imagine there's such a wide spectrum when it comes to how different cultures parent. Even without training, just from me looking afar, I could only guess that parents from different cultures, they're going to instill different values or prioritize different values in their children. So, speaking to an expert like you, how do you discern the different cultures and the different values that parents instill in their children? And someone who obviously is formally trained like yourself, how do you incorporate those nuances when you treat them?
Mhm. Yeah, so I think the first step is having the conversation with the family because you can read all you want, you can be exposed to as many cultures as there are, but as you said, cultures are different and families are very different. So I think the first step is having an open conversation with the families and approaching these questions with curiosity rather than pathology or judgment. So really understanding, okay, why are we doing this? Why is this important to you? And having that conversation. Because what I noticed is when it comes down to really distilling those values, there are differences between cultures, but all cultures kind of want to instill similar values in their kids. They want their kids to be relatively independent. They want their kids to be able to self-advocate. They want the kids to respect others, hierarchy. It looks different in different cultures, and it can be the priorities can shift from one culture to the next, but there are some universal principles out there. And I think once we keep an open mind in conversations with families, this is how we can best explore, okay, what would work for this family so that they're instilling their values, but also we're providing evidence-based care.
Now, can you give us a story or an example of what that conversation would look like? What type of questions would you ask to kind of determine the values that particular family has? Just give us a picture of what that may look like.
Yeah, so there was one specific instance when a mother was asking for advice on how to approach some disruptive behaviors that her daughter, who has a disability, is exhibiting. And she like clearly said that I am against positive modern Western parenting, and I want to show her that there are consequences for her actions, and I think consequences are important. So she said that right out. Right, she said that initially, which made things a little bit easier. So she made her claim. So the next step was I validated the part of her point that I completely agreed with. I was like, yes, consequences are important, and it's very essential that kids know that actions have consequences. How has that worked out for you so far? So I explored that piece. And also I said, okay, consequences are very helpful in stopping behaviors right in track. They do not necessarily teach alternative behaviors. Let's think of ways we can use consequences and also think of ways where we can encourage these alternative behaviors. And that was a way where I did not challenge her idea. She thought hierarchy, respect, consequences are extremely essential. And I used those same values. I respected those values. I kept them there. And I added some pieces where this could be helpful. Because at the end of the day, even families that are coming in with different cultural backgrounds, they are coming in for advice, but they want to feel that the advice is tailored for them and not, standard, and they're going to have to apply it with a different set of values.
Now, you mentioned the word pathologizing again in the past. Now, how easy is it for clinicians to pathologize parenting techniques or something that they see in the exam room, but it may be within cultural norms of that particular family? Do you find a lot of your colleagues fall into that trap?
I think we all do. So I'm not immune to that, even though I come from a different culture myself. But sometimes we get so wrapped up in the evidence and the recommendations that we don't notice the pieces that are based on evidence that was synthesized from a different culture. So one example that I always give is authoritarian parenting versus authoritative parenting. So there is a lot of evidence out there that authoritarian parenting is associated with a lot of negative mental health consequences for children. However,
Now,
there
for those who aren't familiar, with the distinction between those two terms?
So authoritarian is basically there's a lot of discipline and not a lot of emotional connection or emotional expression in typical ways. And then authoritative is when there is a balance of there is discipline, but also there's a lot of emotional connection and positive relations in again in a typical way that we know of. So it's sort of this sweet spot of balance in authoritative, whereas authoritarian is often very much based on disciplining rules,
Hmm.
not a lot of availability in terms of emotions. So it has been shown time and time again in the literature that authoritarian parenting is associated with negative outcomes in children. However, there have been studies coming out of very different countries, so particularly like the Far East, some in West Asia as well, showing that authoritarian parenting is not associated with negative outcomes in collectivist communities where the values of hierarchy and respect are prevalent. So it's very consistent with the culture where the kids are raised, and it's not associated with psychological outcomes, which I think this was the first moment when I was like, oh, so I need to really expand the way I see things. So it is associated with negative outcomes in some settings, but not in all settings. And this was the first time I realized that I myself pathologize a lot of
Hmm.
parenting behaviors, even though I come from a culture with all sorts of different parenting values.
How difficult do you find it to approach this with curiosity? Because that's something that you mentioned early on. The pediatricians who may be listening to you, of course, they bring their own biases into the exam room based on how they themselves were raised and their own cultural norms. Now, whenever they encounter a family that differs from their own cultural norms, how difficult is it, or can you give any tips on how they could put aside their own biases and approach that particular family in front of them with curiosity rather than judgment?
Mhm. Yeah, it's very difficult. I'll say that. I think we all come with our own biases, not just because of our training, but also, as you mentioned, because of our own backgrounds. I think the first step is acknowledging that we do have biases. I think the first step is when we have an automatic thought of, oh my God, how are they doing this? Is to just pause and then really explore that with the family. So explore why that makes sense, even if the this parenting technique that this parent is using sounds very, awful. And it could end up being like a bad technique that we want to fix. But the way to approach it is with curiosity. This doesn't mean that we don't correct behaviors that we think are just obviously wrong. It's about how to approach that conversation from a place of curiosity, how to keep those values there. It is often the case that all of these techniques are coming from the best of intentions, but we want to be curious about, okay, why is this value important to you? How can we instill that value while, promoting something else? So I think the first step would be aware of your own biases. The second step would be whenever you have an automatic thought, pause and examine that thought. Where is it coming from? Is it coming from a bias? How can we have the conversation? And then the third step would be just really to have an open conversation with the family as, thinking of whatever recommendation that I'm going to give. It's not going to be something that I'm giving to them. It's going to be something that we deliberate on.
You mentioned earlier that a lot of the evidence that is in this field may not be representative of the various cultures that one may encounter in the exam room. So tell us more about that evidence in terms of what's out there. What are the cultural norms of the current evidence?
Yeah, so there is an interesting article that turned into a book, and it is called The Weirdest People in the World. And weirdest is actually an acronym for white, educated, industrialized, rich, democratic, which describes the common features of the populations that are the study samples of a lot of the evidence in psychology, sociology that's out there. And the claim that the author made in his article and later in his book is really just to say we have to be humble about the evidence because a lot of the evidence is synthesized from populations that are not necessarily the norm for the rest of the world or for other cultures. And I think this book really shows how a lot of the evidence out there is coming from these types of populations more so than the rest of the world. And on top of that, how some studies from different parts of the world are showing some conflicting results in terms of the conclusions in these fields. So, and the conclusion is not obviously ever to, dismantle the field or throw conclusions out the window. It's really just to expand it. And it's really, it comes down to our responsibility as clinicians and also as researchers to really be inclusive of other cultures, other opinions, other voices in the studies that we do so that our evidence is more generalizable.
We're talking to Najat Fadlalla. She is a developmental behavioral pediatric fellow. Today's Kevin MD article is How Cultural Competence Transforms Modern Parent Coaching. Najat, let's end with some take-home messages they want to leave with the Kevin MD audience.
Yeah, I think my main take-home message is we all need to examine our own biases. We need to stop and pause whenever we have an automatic thought about how a family is operating, how a mom or a dad is parenting. And then we need to really keep an open mind to new evidence, different ways that people around the world are parenting or approaching all of these domains. And eventually, we have a responsibility to really look at it and the evidence with a different lens and make sure that whatever recommendations we're giving are both evidence-based, but also culturally relevant and appropriate.
Najat, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you. Thank you for having me.